Well, I've been a consultant here for over 20 years now. It's been a great place to work. I've thoroughly enjoyed it. I think Cornhill's got the advantage of it's a university teaching hospital. It's got all the facilities that go with that and the kudos that go with that. But it's not a massive hospital. It's small enough that I know all the old age psychiatrists, I know the addiction psychiatrists. It's a friendly place.
I came here 29 years ago to work as a dietitian, and over time I moved into management. I absolutely felt like I'd come home when I came to this hospital.
My experience has been overwhelmingly positive working in Royal Cornhill Hospital. I've had a lot of support throughout those years in managing transitions between years and between core training and high training, and I've been regularly supervised and been supported throughout that time.
My role is a liaison psychiatrist, so I work in the general hospital site where we will see people who have present with mental health problems in the emergency department and in the general hospital. I also do an outpatient clinic where I will meet with patients who have mental health problems in relation to physical health problems. So there's a huge range of both general psychiatry and of physical health problems.
It's funny trying to think of my normal routine day because it's so varied being a trainee here. I get all sorts of opportunities. So yesterday I was doing Year 4 teaching. Today I'm going up to Fraserburgh to speak to some people from the Scottish Government about drug-related deaths. I sit in on management meetings. We have a very good relationship with them here in Cornhill. Supervising nurses, having clinical time obviously, doing clinics. It's all very varied.
I think Royal Cornhill Hospital is great because we have every psychiatric specialty represented on the same site, and we have great relationships with all of our colleagues in psychiatry, psychology, nursing and other allied health professions, all based in the same site, and everyone knows each other, and we're also very close to the Forester Hill site.
There's a close relationship between Royal Cornhill Hospital and the University of Aberdeen. 2019 Scottish University of the Year, the top 30 UK universities, and we will go up to the medical school, the Sutty Centre, and provide tutorials and lectures. So yeah, there's a close relationship, and there's always support there in developing your own skills and lecturing and tutoring too.
Just now we've got a lot of investment going into the site as well. There's a lot of money being spent on ligature reduction work, and we're well through a project to do complete refurbishments of our admission wards at the moment.
I've had so many opportunities both from the hospital and out with, and when it comes to study leave in this hospital, they've always been very kind of welcoming and kind of almost push me to kind of take up opportunities, as well as the study budget and things as well that's available. I've never had any problems getting study leave or getting funds for that study leave.
With regards to our clinicians are not just involved in service delivery, they're also involved in planning services for the future. And that interaction is really, really important to make sure that we provide the best service we can for our patients going forward.
But certainly when I've wanted to do something, whether it's work in a gender identity clinic or work in a pain management clinic, I've always been supported in doing so. So it's just easy to see how I can develop all the skills that I need to be a competent consultant, and see a path forward into finding a fulfilling career as a consultant in the future.
I think Aberdeen's a really interesting place because although it's a city, it's not that big, and it's got very ready access to beaches and mountains, and fantastic if you ski or if you play golf. There's a really good quality of life here. There's good schools. There's also good links with airports and rail. I think this is a really friendly place to work, and that's the feedback we get from people who come here. Like students always comment on the fact that when we meet people in the corridors that they smile, and people work very closely, and I think there is quite a lot of socialising that goes on out with work as well.
I've been working with Grampian for 8 years, working in Royal Cornhill Hospital for the past 6 years. I've never felt limited in any way. There's just always been so many opportunities. It's always been a very welcoming environment. I've got a lot of friends here that kind of work in the hospital, And yeah, I can't imagine kind of working anywhere else in the foreseeable future.
The reason I've stayed is because it's a very nice place to work. I think we serve our patients very well. I think we look after them well. We're well funded up here compared to a lot of places in England. We've got a good Mental Health Act in Scotland, and yeah, when I end my career, I'll be very sad to leave this hospital. It's a place I'm very proud of.